I'm so pleased to have my guest join me for a topic today that I feel has been necessary and very important to bring to the forefront of breast surgery and breast reconstruction. And that topic is reconstruction options for those with stage 4, also referred to as metastatic breast cancer. My guest today is Dr. Minas Chrysopoulo. He is the current president of PRMA, that stands for Plastic Reconstructive Microsurgical Associates. He works with his colleagues in San Antonio, Texas. They focus primarily on autologous breast reconstruction. I also want to add that a convincing motivation for me today for having this conversation with you, Dr. C, we're going to refer to you as Dr. C today, like all your patients do, is that you are the developer of the Breast Advocate app. So how are you doing today? Welcome back to the Deep Sea Foundation YouTube. Yeah.
Thank you. Great to be here as always. I love the fact that you pick on topics that really need the discussion, right? So I appreciate the topic of the day. It's obviously extremely important, but it's really under discussed. And it's the perfect topic to empower patients on, right? So they can be their own advocates. And really, these videos are so helpful, and I really appreciate you doing what you do, because all these tools that we make available for patients, everyone's got a different learning style. So as you kindly mentioned, the Breast Advocate app, that's my baby. You and several other patient advocates were tremendously instrumental in putting that together. So many thanks for the efforts that went into that from you in particular, and your ongoing support. Some people don't like apps. Some people just prefer videos. Some people like hard print stuff, on paper. It doesn't matter what the medium is. I think as long as we're putting the information out there for people to educate themselves, we need to keep doing that.
Yeah, we all have different
modalities.
Yeah, exactly.
But Breast Advocate's going great. Thanks for asking.
Yeah. Well, how about we just start out? I know that you have some slides to share with us today. And I have to tell you, Dr. C, this is, addressing the topic that we're addressing today. It feels hopeful and positive to me, because I'm not sure 5-10 years ago we would have been having this conversation about reconstruction.
We weren't.
Yeah,
we weren't at all. And certainly when I came through my training, that an indication, stage 4 disease was not. I mean, you wouldn't be talking breast reconstruction to patients with stage 4 disease.
Right.
Medical treatments have come a long way, very long way. And now it's a very appropriate discussion to have in some patient situations. So very much on the table, very much on the table, and a very important aspect of quality of life for patients with stage 4 disease, if they're interested in breast reconstruction, right? I mean, it's right. For some, it's not their thing, and it's all options. So whether it's breast reconstruction or tweaking the results of mastectomy in the form of aesthetic flat closure, whatever the option is that people choose, just because they have stage 4 disease doesn't necessarily mean that those options and further surgery are automatically off the table.
Of course.
Let me share my screen.
Let's
kind of.
You've got some
because
great.
you wanted me to kind of walk through the app a little bit.
Yes, because you have some great visuals today. So here we are talking. We've got that learning modality. The visual part of this, is another learning modality for people to watch and see the steps. I think sometimes when people hear the word app, they're like, not knowing how to use it. So I like what you've put together today to give us a step-by-step look at the app and all the benefits of it. I have so enjoyed watching it develop and now be used, in the community that we both serve. So it's really an honor to talk about this today with you. I'll let you take over now.
We have over 20,000 users now, so it's pretty great organic growth. It's awesome,
that's fantastic.
Yeah. So the app is really, it's the first shared decision-making app specifically for breast cancer surgery and breast reconstruction. So we wanted to focus on breast cancer surgery, all the different types. And so when we put the app together, as you remember, all the sessions, the brainstorming sessions and the discovery sessions we had with the various patient advocates, everyone was really represented in terms of demographics. We had women, we have men, men get breast cancer too, of course. We had lumpectomy representation, mastectomy, aesthetic flat closure, and all the various gamuts, all the various types of breast reconstruction, oncoplastic surgery, all the different types of mastectomies, nerve reconstruction to restore feeling, all these different modalities were represented by the patient advocates at the table, basically using their voices and telling me what they thought was lacking out there in terms of the decision aid. Now, over time, what we're wanting to do is actually increase the content of the non-surgical aspects too. And there's a bunch of that in the app already in terms of the medical treatment, radiation, genetic testing. So there's a bunch more other non-surgical information in the app. It's just that the medical oncology and radiation oncology side of decision-making isn't to the same depth of detail that we have for the breast surgery.
One disease, so many things to know.
Oh my gosh, so many things to know, so many options.
And so many subspecialties and options, exactly.
Yeah. So,
and it's free.
Basically, the whole point. It's free.
It's free.
Download it at breastadvocateapp.com. Free download for Android and iOS, iPhone and iPad. And really, the whole point of this is to give patients the opportunity when they're not face-to-face with their healthcare team to be able to research their options, become educated, so that when they are with the healthcare team, they know which questions to ask, they know what topics are important to them, and so that way they can have the conversation that they want to have, and they leave with more of a personalized experience, right? Because I'll tell you, as a physician, you've got X amount of time, and if someone comes in and they have no education ahead of time, you're starting from ground zero and you have your set spiel, and then before you know it, the time is up and you haven't really personalized things that much. Using shared decision making, I'm a big fan of that, but the app has really allowed me to up the level of shared decision making, because now patients review all the information that they feel is important to them in the app before they even show up to the visit, and then we have a quick review of the overall kind of a summary discussion, make sure that they know the options, and then we can really drill down and spend the rest or the majority of the visit really focusing on the specifics that are important to their specific situation, their specific social setup, their specific work requirements, leisure activities, all these things are really important when it comes to shared decision making. So the app has really allowed me to become better at shared decision making, because it removes a bunch of the general basic knowledge that everyone gets and needs.
And so much overwhelming information for
Yeah, and
Yeah.
you know, one visit with your team isn't going to do it, right? But having everything, you know, on your phone, on an iPad, um, that allows you to use the tool as many times as you need, and you can educate yourself up front. Then you can go back and you can re-review information afterwards. You can
And
often find
if things change,
yeah, things change all the time. So anyway, that's why I created the app. But thankfully, you know, I'm very glad that from the get-go this wasn't designed to be practice specific. It wasn't designed just for my practice specifically. So this is for any practice, and it's for any patient. And I think that's why it's been successful.
Yeah.
So when you download the app, you'll get a home screen, and from the home screen, you'll get the option to go to the knowledge center or the community, as you can see here on the bottom. So once you click on the knowledge center off the dashboard, off your home screen, you'll come to this page. So this is after one click from the home screen. I should have put the home screen in here as an image too, so you can recognize it. But basically from the home screen, you click on the knowledge center, and that gives you a list of situations. Now, this is after scrolling down the page a little bit to get to I am stage 4. So we have an entire section dedicated to metastatic breast cancer. At the very top of this page, I'll read them to you. It says, you know, we've got a segment on shared decision making. I want to be part of my treatment decision. So I got a whole section on teaching people what that means and how that looks. I was recently diagnosed with breast cancer. I had chemo and now need surgery. I have inflammatory breast cancer. I am high risk. And here you have from there on down the various situations. And I don't know if you remember, but during those patient advocacy sessions that we all had together when we were brainstorming on what should go into the app, the comment that came from the group was that they wanted content that was split up based on situations rather than topics. So, you know, most other apps or educational sources, they'll split it up into things like, you know, mastectomy, lumpectomy, breast reconstruction. It's not situational. So someone, because how do you know that mastectomy is what you want to research? How do you, you know, so rather than specifying the actual topics, we made it situational. And now you click on whichever statement best describes you, and then that shows you the options. So we have a whole section on stage 4. And then when you click on that, you have here, it basically shows you all the content, and then you can drill down just to the articles or just the images or just videos or just the links. Links are to other resources, other helpful websites, other helpful organizations, all sorts of different links. So here, as you can see, we've got specific articles defining what the disease is, discussing surgery for patients, who's a candidate. And really, you know, let's talk about who's a candidate for a second, because not all metastatic disease is the same when it comes to being a candidate for surgery. It used to be that if you were diagnosed with metastatic disease, no one would advocate any kind of surgery unless it was for hygiene reasons. Like if you had a lady who had a cancer that was coming through the skin and there were hygiene issues and it was a wound care issue, then a mastectomy could be recommended, was oftentimes recommended just to basically clean things up from a quality of life issue. But beyond that, if you had a well-contained lesion, well-contained cancer, your stage 4, you would just get treatment for your stage 4 disease. And that was that. Well, then studies started coming out that really started to question that approach. And some women now have mastectomies even after being diagnosed with stage 4 disease. They have mastectomies or lumpectomies because there's evidence now to show that that improves the response of the treatment, of their ongoing treatment. And it can actually improve their survival and lengthen it. So by the same token, if you have a patient who has stable metastatic disease, and so this is very much a multidisciplinary conversation and decision, like it always should be. So the medical oncologist absolutely must be involved, the surgical oncologist. So the question is this patient stable, right? So some types of metastases, for example, bony metastases. So if you have lesions in your bones, that's metastatic breast cancer, those lesions can be stable for a very, very, very long time, and they can be contained. And so that's an example of a stage 4 situation. So these articles talk about those sorts of situations, targeted therapy. You see here, I kind of mentioned that the app's main focus, our main niche, is the surgery aspect of things, but obviously non-surgical factors are very important in determining the surgical decision making too. And so it's very important to include some of that, a lot of that non-surgical information too, and that's what we've done here.
And I do really like the fact that you mentioned this coordinated care, integrative approach with the other healthcare teams. It's so important. Thanks for mentioning that.
No, not at all. Now, the other thing, I know you like the feed and the customization. So we've made the app very customizable, and so you can go in and basically on the home screen of the app, there's a feed, kind of like Facebook. You have a feed, LinkedIn. Everyone has, all social media has a feed. So it's a concept that's very well known and accepted and user friendly. So on the home screen, you basically got two things. You've got the wizard, the treatment wizard, which helps you decide what kind of surgery is probably best in line with your preferences and your situation. And then just below the wizard, you've got the feed. And so you can customize the feed by basically choosing anything that's appropriate to your situation. So under my feed, if you click on I have METS, stage 4 here, then your home screen, the content that appears in my feed or in your specific personalized feed is more to do with stage 4. Because if you're a lady with stage 4, you probably don't need to read all about male breast cancer in your feed. Right?
You're drilling down.
So, for example, exactly. The problem with a massive topic like breast cancer is that, and you know how overwhelming it is, you want to have a tool like this in place to help you drill down so that it makes things a lot easier to navigate.
I'm looking at mine right now.
Yeah, there you go. And then, we also have a search function. So on most screens in the app, you've got this magnifying glass icon. So we tried to make the search engine pretty sensitive. So, even one word, if you type in one word, you get some, you get everything you need instantly. So here, for example, when you look at the search page here, we've divided it into articles, images, videos, resources, community, etc. So here are some of the resources that we have for stage 4 patients, and it's guidelines so that you can educate yourself on what the guidelines are that are guiding the treatment recommendations that your doctors are recommending for you. And we also have links to trials.
I love that. Love that one.
So yeah, and so a lot of the time people don't even know they have access to trials, and that they have that option, which a lot of people do. And sometimes, it's going to involve traveling, just like sometimes, you have to travel for other parts of your treatment or surgery.
Right.
And we also want to provide information for folks who really want to get into the education and get even more detail. And so we've got not just articles from our expert contributors, because obviously the app, I'm not the only one who wrote content in the app. We had medical oncologists, we had breast surgeons, we had a whole spectrum of specialists and patient advocates across the gamut. It was the whole range, multidisciplinary range. But we also have links to evidence-based articles. Not all of the articles are the full article. Some are just the abstracts. For most people, that's good enough, and that's enough. Others want to drill down even more, and they want to see the full article, and we have as many of those as we're allowed to include.
Well, what I like about that is that varying degrees of interest, like you said, about reading these articles and the abstracts, like you said, you'll have the abstract, the conclusion, and all that, which is fine for some, but then for those that want a full, more, more detailed. But here's what I always tell patients, if these articles feel overwhelming, but if the title and the research that you're looking for feels specific to you, it's print it up, highlight some words, take it to your healthcare team and let them discuss it with you, because chances are they've seen the article. Yeah. If they haven't, even, that's more shared information. So there's that option too.
For sure. And then it's really helpful, honestly, to understand where the patient's coming from. Also, it gives us an indication of what kind of interaction they're seeking. And what level of information is important to them. It can also help us re-educate if it's a bogus article. And it can also help the patient educate us if it's an article we haven't seen.
There you go.
So it's a win-win all the way around, right?
Yeah.
So I think it's great when people bring articles in, because it's very insightful on many levels,
Yeah.
And there have been times where, it's something that honestly I didn't know much about, and it's been a catalyst for me to learn about it. So very, very useful.
Yeah.
And here's just an example of some of the kind of full article, some things we have that have, access to the whole article, just for some examples. So that's really just a very quick, PowerPoint, just to show you how to drill down and how to get to the information you want really quickly if you're a patient with stage 4. I would say that, if you have stable disease and you're interested in breast reconstruction, absolutely look into your options. Most patients with stage 4 disease, in my experience, have had radiation. Some patients are de novo stage 4 diagnoses, and they haven't had radiation before.
De novo for our listeners, meaning first diagnosis. Meaning,
your first diagnosis is as a stage 4 diagnosis.
Correct.
So versus early stage disease, which you're diagnosed earlier on, where the cancer is confined to the breast or the local area.
And then it
So,
spread later to become stage 4.
And then it spreads later. And 30% of patients with early stage breast cancer will become stage 4, which is a statistic that isn't discussed very often, but that's the reality of things. So it really is a very important quality of life decision for many patients. The options for breast reconstruction in a stage 4 patient are pretty much the same as any other stage. If the patient is a candidate for breast reconstruction, then all the options should be discussed and the pros and cons of each. If this is a patient who's progressed and has had radiation in the past, then implants aren't going to be as good an option as using their own tissue, because radiation increases the risk of complications with implants. I think patients hear that a lot, and that's also the reality. Doesn't mean an implant reconstruction cannot be done in the setting of radiation, but in terms of outcome, in terms of risk, complications, and satisfaction, tissue reconstruction is a safer option, and for most people, a better option. So there are those considerations. The other thing is that breast reconstruction absolutely cannot interfere with cancer treatment.
Right.
So this is all about aligning the patient's situation, as always, prioritizing their cancer care, and adding breast reconstruction to the mix. Not just if it's appropriate, but when it's appropriate, right? Because the timing can matter too. So,
and again, why the coordinated care is so very important. Dr. C, do you feel in the metastatic or the stage 4 setting that patients are a little more hyper aware of their care, recovery, who their team is, in hospital, clinical care? Do you find that they're a little more hyper aware of that, or do you get a little bit of a mix, just as you do with any other patient who's affected by breast cancer?
Yeah, in my practice, it's a mix, because we don't have the standard demographic anyway. Because so many of our patients kind of seek us out and travel, and so they're already super involved and educated and of that mindset. I can see why you would say that and why you would ask that. It's a good question. But really, for me, it can be, it's all over the place. It's really, it's not something that's more heightened in that patient group, in my personal experience. But
I do feel to some degree, don't know how you feel about this, but and if you would want to comment on it, but I do feel to some degree that this gives patients with a stage 4 diagnosis a little bit more control over the situation. If
that's
they're
a great
able.
point.
Yeah.
That's a great point. I mean, that's breast cancer. That's so, yes, I agree.
It's in general, though. I felt that way. I have
in
to
general,
say.
yeah, I've talked about this notion, in the past, the lack of control that comes with a diagnosis, right?
Yeah.
But it's not limited to stage 4. Obviously, the stakes are different to, if you're diagnosed as an early stage, at an early stage, and then you progress and you have another diagnosis at stage 4, most patients feel the impact of that advanced stage now, and the differences. It's very personal. But you can have, I don't know many patients that feel they've had much control of the situation, regardless of the stage at which they've been diagnosed.
It's very true.
Right.
This is very true.
It's so personal, so difficult. Yeah, I think that the control, or more appropriately, the lack thereof,
Right.
it's an immense issue for people.
Well, as I said, this is a very hopeful topic for me to be able to talk about. I'm so in admiration of my friends and fellow patient advocates in the stage 4 metastatic space who have come on strong the last 5 years, really. I saw it at the San Antonio Breast Cancer Symposium. I was, spent a little bit of time with you after that or during that time. And I just am in admiration, but also in gratitude to them. Many of them have expressed the benefits of having hope in this situation. And I think we can do that more these days because of the treatment options, because of the quality of life, because of survivorship. And also, I mean, from my standpoint, in my corner of the world, I'm glad that they can now explore options for breast reconstruction if that's what they would like. Do you feel this might be a tricky question to answer, Dr. C, but do you feel amongst your colleagues who are doing reconstructive surgery that they're still a little bit hesitant to do reconstructive surgery on a stage 4 patient, or do you find that those doors are opening up? How have you
I think
seen?
they're opening up. Yeah.
And does it cause an access problem because of that? That's a wide open question, I realize.
Yeah, I certainly think that not everyone is on board with this topic and having the conversation. I think it's getting better.
Mm-hmm.
I think access is improving. I think more surgeons are open to having the conversation and considering it. But I mean, it's certainly a sea change compared to compared to the teaching that I had when I came through training.
Oh my
So
goodness.
it's Terry, how many examples of this are there that you and I have discussed? Some of them on podcasts, some of them on YouTube, and some of them, um, on offline. But things are changing. Some people embrace change more than others. Some people are open to new things more than others. That's just the way of the world. That's human nature. It's no one's
Correct.
fault. You just have to align yourself with the right individuals who are willing to have the conversation that you want to have. And maybe at the end of the day, the end result and the conclusion from that conversation is not doing things, not doing breast reconstruction or not changing anything, right? But that's got to be, a two-way street, a conversation, and considering all the pros and cons, and exploration. Otherwise, without exploration, you have regrets. So I just, there are going to be patients who unfortunately are stage 4 and who aren't good candidates for breast reconstruction. That's the
Right.
reality of the situation, unfortunately.
Right.
But what we want to avoid is people, having the metaphorical door slammed in their faces, when they try and have the conversation, or, just being dismissed. That's what
Yes.
you want to really avoid. It's just the conversation is important, irrespective of the outcome.
Yes.
Um,
Because with
so that,
conversation, we build trust. And then
yeah,
patients and the provider, the surgeon, they can build that trust in the decision that they make together. So it has to start with the education and the conversation, as you said.
yeah,
Yeah.
exactly.
Yeah.
And sometimes, patients also need to realize that, obviously time is exceedingly valuable in terms of the commodity, and it's very flippant sometimes to say things like, oh, let's see how things go and reassess down the line. And you're like in your stage 4, and you're like, dude, that's not the kind of approach I want here. I kind of want something more definitive. But sometimes, as I said, you can't interfere with cancer care either. Right. So it's going to be a balance in terms of being a candidate and then getting the support for the appropriate timing, so that it doesn't interfere with anything else that's actually going to prolong your life.
Yeah, I think clarity and clear, straight answers are so important. And I can't think of a better resource than this, these great slides that you shared today, to arm patients, no matter what stage of the disease or how they've been affected. There's many high-risk patients. I can't think of a better way to educate and inform them than to use something like the Breast Advocate app. So I really appreciate you sharing about that today. And also, I know you've been in clinic today. I always like to acknowledge the fact that you have shared your time after spending the entire day with patients, and I so appreciate that. It's been enlightening and hopeful. And I want to just, tell our listeners, if you have questions or comments, please drop them in the comment section, because I will look at those. And as I always say, if I can't answer them, I will reach out to the interviewer today, or the interviewee, Dr. C, and see if I can get some set-pat answers from him. But I guess if we repurpose this for a podcast, which I have been doing of late, I will have to reference the fact that you'll have to jump over to the YouTube channel also and watch the educational video portion of it to really get a view of these wonderful slides that you shared today, and walked us through really some of the pertinent items that are on the app.
Well, I appreciate the opportunity. Really do. Thanks very much for doing this.
All right.
I love talking to you.
Yes, I know. It's always
to be continued, I'm sure.
Oh, to be continued. I will put you back on the schedule as always, but I do thank you for joining us today on the Deep Sea Foundation educational channel. I don't even think I said that up front, but here we are chatting again, and we will see if we can perhaps repurpose this for a Deep Sea Journey podcast as well, so we can use all those learning modalities that you talked about, Dr. C. Thanks for joining me today.
Always. Thanks, Terry.
Take care.
Bye.